866-826-1340. 866-826-1340. Now, back to Dr. Jennie and Dr. Marc.
Good evening and welcome back to another segment of the Hit and Run Medical Hour. I believe we have Virginia on the line.
Yes.
Miss Virginia, good evening. How are you?
I'm fine. This question is for Dr. Marc.
Yes, ma'am.
Yes, I survived spinal meningitis about 14 years ago and almost died. And since then I've noticed changes in my immune system and wondered if there is some connection and are there long-range effects after surviving meningitis?
Well, that's a great question. Did they ever define the actual cause of your meningitis?
I taught in a high school, and they think that I caught it from one of the students.
Yeah, sure. And this was before the days of the meningitis vaccine.
Right, exactly.
Yeah. Well, actually, I don't know of any cause and effect between having meningitis and then later immunosuppression. What symptoms are you now experiencing that make you believe that your immune system is somehow depressed?
I catch things easy and joint pain.
Joint pain?
Yeah.
These are very soft, and I don't know that they necessarily signal any immunocompromise. Again, anyone really is susceptible to meningococcal disease, and I don't know of any immunologic sequelae as a result of that. But certainly there are other long-term problems that one can have after meningitis, but these don't seem to be the things that you're presenting in this call.
Okay, yeah, because I wondered if there was anything, I should be looking out for. Because somebody had mentioned, the doctor had said sometime I might need steroids, and forget it.
No, actually, we wouldn't, especially if you had an immune problem, we certainly want to treat you with steroids, which are generally immunosuppressants. They usually suppress the immune system, and we use them to treat a lot of drugs, a lot of diseases for that.
Right.
So, no, I wouldn't recommend trying any steroids. I would just take my vitamins, say my prayers, go to church. What are you doing down there in Sun City? Are you?
I'm busy.
you are busy.
Yeah.
Well, are you driving the ambulance or?
No, I still teach 3 days a week.
What are you teaching?
I teach art in Sun City 2 days a week, and then I go out to the women's prison 1 day a week.
Fantastic. Well, that's the key. Stay active.
Oh, yeah.
And by all means, give us a call if you have any problems.
Okay. Thank you very much,
Thank
Marc.
you for calling.
Okay. Bye-bye.
Fantastic, Dr. Blum. I just love when your medical knowledge shows like that. It's so cool.
Have you ever been to Sun City, Dr. Yates?
No.
We'll have to take you down there for a visit someday.
It's an entire city all in itself, right? How many people live there?
Thousands. It's like a battleship.
It has been described to me before that is it every day or every week there's at least one golf cart incident?
Pretty much every day. There is at least a golf cart versus another golf cart, or a golf cart versus a car or something, yeah. But
they seem to be a very active place, though. There's always some activity going on.
Well, we
in Sun City.
discourage the drag racing. We discourage them from drag racing those golf carts up and down the main street. That's a problem. The guys are just always, men never change.
Right.
They put the big mag wheels on it. Some of these guys are dropping their golf carts.
Ooh, cool.
Yeah. And they're cruising for chicks. They hang that big old bicep out the left side of the passenger side of the golf cart, and they're cruising chicks at the vitamin center.
All right.
Yeah. Instead of the DQ.
Well, no, I'd love to check out Sun City Center one day.
It's a happening place.
It is. It really is. Honestly, my grandma was talking about moving there to Sun City Center just because she's heard so much about it, so many good things.
I don't think your grandma would really like Sun City simply because she enjoys mowing the lawn too much.
She does, yeah.
Yeah, and she likes getting on that thing for a couple hours a day, and you wouldn't be able to buy that much property down there.
Speaking of grandma, she always told me to feed a cold and starve a fever. Is this...
That was quite a segue. That was very good.
Is this...
Feed a cold and starve a fever.
Yeah.
Well, you can...
Is this old wives' tale, in fact, correct? Or not correct?
I have a problem with that. I'm going to say incorrect.
Oh, you got it again. You really did. There's no evidence the diet has any effect on either a cold or a fever. Even if you don't feel like eating, you still need fluids, and so that is always a priority with either one. If you're congested, the fluids will help keep the mucus thinner and loosen up the chest and nasal congestion. Any other words of advice from our wonderful local medical doctor on feeding a cold, starving a fever, just hydrate?
And supersize it. I mean, get the fries and the drink.
Oh,
no. Well, if you're sick and you don't feel like cooking, you're going to go through the drive-thru. So I say, feed the cold and the fever.
With a nice Wendy's salad or something?
Okay, yeah.
Yeah, okay. Not the 12-pack.
Not the nice big juicy
tacos.
burger. No, I hate that.
No. You said the ladies at McDonald's know your name.
They know my car.
Oh, they
don't know my name. I can hear in the intercom, he's back. The guy, he's back.
Here's an interesting one.
Yes.
That comes up lately because, in fact, right now we're hosting, at my office, we're hosting an organic living seminar, and it's all about gardening and being able to garden organically at home. It's a free workshop. It was actually absolutely packed. We actually started a waiting list, so we should have it again.
You did have a huge response to that.
We did. They were full when we left, and that was well before it was supposed to start, so hopefully they had room for everybody. But we are going to have one in the next month or so. But part of that is, fresh is always better, right? The fresher, the better. But is fresh always better than frozen? It's interesting to...
I think in terms of the vitamin content, I would say generally that's true. Is that not true?
It's kind of...
We're going to find out.
It's up in the air.
Oh.
It's up in the air as far as that goes because... many times they're taking the very freshest vegetables and they're freezing it right away. Mm-hmm. So that's locking in some of the mineral content. Versus if it's traveling a far distance, we're getting our tomatoes or what have you from Argentina or from Chile or from wherever. It's going to lose some of its nutritional value when it's traveling for weeks or months.
Well, I'm a survivalist and I have a little garden in the back. So all of my things are very fresh.
You don't garden.
No, I do.
You do?
Yes, I'm a big gardener, and I love the organic foods.
Mm-hmm. They do taste better. They do. There's not two ways about it. Is there? Do you know of a farmer's market over in
ketchup.
Tampa?
It tastes better with a lot of ketchup. Put that in.
And whipped cream on the fruits, right?
On the pumpkin pie.
Ooh, pumpkin pie.
Yeah, fresh cilantro on my pumpkin pie. Good
old-fashioned pumpkin pie. Forget about it. I didn't realize that I never knew what an actual pumpkin pie looks like because they're really like a light brown color. They're not the deep orange brown color that you get in the can.
Is that right?
It's true. Yep. There was at my old office, one of the employees would make a fresh pumpkin pie for Thanksgiving, and she brought it in, and I said, what is that? I've never seen such a thing. She said, it's a pumpkin pie. I said, a pumpkin pie? I don't know. It looked not the best. Not as pretty, but my God, it tasted so good. We'll have to make one day.
Yeah, I'll give her a free visit if she brings a pie.
Ooh, good call.
Have her out there.
I mean, the complicated visit or just a simple visit?
Well, it depends on how much pie she brings. If you want an extended visit, I expect a pie with the vanilla ice cream.
Well, after you saved my life, I brought you 2 slabs of ribs and some potato salad.
You did, Dr. Yates, and they were absolutely delicious. I can't thank you enough for that.
Wait, you're not supposed to eat ribs.
No.
Eggs
But you're not supposed to drink cheap wine, which is not to betray a doctor-patient confidentiality, but that cheap wine
I no longer
for
drink cheap wine.
It's got to have a bit to the Steel Reserve, or
oh
what
my God!
These days, Dr. Yates.
None of the above. Black and tan and Guinness.
Nothing but the best.
Oh, nothing but the dark things with the antioxidants. That's why I drank red wine anyway. The health effects.
Really, yeah, I drink to forget.
I always forget there's one thing that's in red wine that's not in grape juice.
And that is?
I know, I always forget it. I'm telling you, I forgot.
Is it resveratrol you're talking about?
Resveratrol, okay. Yeah, I think so. There's another word for it, though. Resveratrol.
Alcohol.
Roofies? Roofies? Is that we caught you? No, roofies are not supposed to be in your drink, sir. Yeah. But
you get a lot of requests for medications at your office, don't you? I mean, medications
I do. We get patients coming in. They've seen commercials and they want to know about a certain drug, or they've decided that they have a certain ailment and that they've made the diagnosis. They got on the net and they've decided they would like a certain product.
If you have X, Y, and Z, consult your physician. Ask your doctor about so and so.
I love that.
You know, I used to get. I do have to share this. I used to get so upset with the pharmaceutical marketing because literally any show you watch, particularly in prime time, is full of one medication after another medication after another one.
God bless America.
And I said that's terrible. And I brought that point to you. I said that is absolutely unethical. They shouldn't have that stuff on TV. They're telling people to ask for these medications, and you had the very best answer.
No,
you said it is up to the physician to prescribe a medication or not prescribe a medication, and all of the responsibility lies with them. So let the pharmaceutical companies advertise whatever they want, because if it causes one sick person to seek care for something that they may not have sought care for, then it's worth it.
Absolutely. As long as people come in and at least give me the opportunity to listen to them, examine them, and then perhaps discuss what my findings are. And offer some alternative therapies, let them know where that particular product lies in the options.
Right.
And so I have no problem with that.
Right after you set me straight, I no longer had problems with that. I don't get upset at the pharmaceutical commercials anymore, even though they're pretty hilarious. Because
what I want to know is why that male enhancement pill makes you want to take a bath. Every time I see that commercial, the couple is sitting in a bathtub. I don't understand. That must be a side effect of this medicine.
It's like the bathtub overlooking the beach, right?
Right?
They've got their glass of wine, the bathtub is bubbling, and they're looking out over the beach, and absolutely you think.
And I've read the patient package insert, and I haven't found wanting to take a bath as a side effect of that medicine. So I'm trying to get the connection, but. Yeah.
Oh, man. It's never made me want to take a bath, but it's always made me want a glass of wine. So, I guess not surprised.
I don't know why that's funny. What else do you have there? Do you have any other questions or popular misconceptions that we can discuss?
You know, here's one for maybe not our area of the country right now, but a few weeks ago. If you get cold, will it cause you to catch a cold? Getting cold
if I get cold,
causes a
would
cold.
It cause me to catch a cold?
Mom always said that, right? My mom did.
No, my mother really just told me what she said. Put a coat on, and then there was no further discussion. You had to put a coat on, and you had to wait till you got outside to take it off. But I don't really think that anything less than an extreme case of hypothermia would really cause you to be more susceptible to a cold.
Oh,
how am I doing?
God, that is exactly what it says on this piece of paper. That's beautiful, Mark.
I think that sitting in a nice warm airplane.
Wow, that's pretty good. I'm impressed.
With a 600-pound person slobbering all over you,
right,
would be a lot more risky. Or going to the movies, or something like that. Yeah.
Being a teacher.
High risk. Absolutely high risk profession.
Here's one you're not going to know the answer to, but lipstick could make you sick.
It's been my personal experience that lipstick It depends on how much I eat. If just a small tube generally does not disagree with me. Sometimes I'll